You are listening to the Journal of Rheumatology's Editor's Picks with Dr. Earl Silverman, Editor-in-Chief.
Hello again, this is Earl Silverman, Editor-in-Chief of the Journal of Rheumatology. Welcome you to the April 2025 edition of Editor's Summary. As usual, I will give you part of my interview of this month's highlighted article, which is Disparities in Time to Diagnosis of Radiographic Axial Spondylitis. The interview is with Doctors Fernandez, Espedide, Liu, and Dubril on behalf of all the authors.
Would you like to summarize what you did find?
Yes. So we initially identified 661 patients with the diagnosis of radiographic axial spondyloarthritis. And from them, after we apply our inclusion criteria that I mentioned, to have all this data of sex, ethnicity, race, and the documented social disparities, we ended up with 404 patients in our final cohort. So what we found here is that the average age was 49 years. Almost 40% of them were female. 25.5 of those patients, of all our patients, identified as Black, 43.4 as white, 14.1 identified as Hispanic or Latino, and then 31% either were from Asian, Middle Eastern, or Native Hawaiian race and ethnicity, but a good amount of them didn't report their race. So it was a total of 31% that it was really in that small group, or patients who do not reported their race. So a key aspect of our study was also, as I mentioned, examining the impacts of social determinants of health. And we found that 34% of patients had at least one documented social need, such as housing instability, food insecurity, or difficulty affording medications. And among this group that had the social need, it was 36% who were Black, and 32% reported another or an unknown racial designation. So the delay itself, talking about the delays, we saw that patients who are in our cohort, patients who were older than 45 years, tended to have a prolonged diagnosis, a prolonged delay in their diagnosis, which makes sense. Most of our diagnostic criteria have that 45 cutoff. If you were a woman, maybe you will have a prolonged diagnostic delay. And if you were from Black or Hispanic of Latino, Black race or Hispanic of Latino ethnicity, compared to white patients, you did have a diagnosis in delay. And as well, patients who presented a documented social need. And after we did our statistic study with the accelerated failure time model, we saw that we have an increased delay in diagnosis of up to 21% in those patients who presented a social need. And since the average time to diagnosis for those without social needs was around 34 months, it would mean that the patients with social need experienced an additional 7-month delay in receiving their diagnosis as patients who did not present a social need. And this was even after adjusting for age, sex, race, and ethnicity.
I hope you enjoyed listening to my interview with 3 of the authors of the paper titled Disparities in Time to Diagnosis of Radiographic Axial Spondyloarthritis, and we'll listen to the full interview, which is available at our website, www.jroom.org, or on our YouTube channel. I also recommend that you read the full-length article, as well as the accompanying editorial titled Disparities in Diagnosis, a Call for Equity in Radiographic and Axial Spondyloarthritis Care by Doctors Xiaoshen Liu and Jonathan Kay from UMass Memorial Medical Center, Worcester, USA, which are both available at our website at www.jroom.org. I will now move on to summary of the papers appearing in the April 2025 edition. First paper is from our expert review series and is titled Urine Protein Test in Systemic Lupus Erythematosus. What do they mean? In this review article, Doctors Aflaki and Bargman explore the general mechanisms of proteinuria, and they highlight the limitations of the current measurement techniques used for this and the challenges in differentiating active lupus nephritis from proteinuria from damage. JAK kinase inhibitors are being increasingly used in patients with RA, but it is not clear if they should be tapered when there is good disease control. In their paper titled Baricitinib Dose Reduction in Patients with Rheumatoid Arthritis Achieving Sustained Disease Control, final results from the RA Beyond study, Edwards and co-authors showed that although the continued maintenance of remission or low disease state was greater if baricitinib was maintained at a 4 milligram per day dose rather than if it was tapered to a 2 milligram per day dose. However, 76% of patients who were tapered to the 2 milligram dose either maintained the disease state or could be recaptured if the dose was again increased to 4 milligrams per day. Keeping with rheumatoid arthritis, we know that rheumatoid arthritis-associated interstitial lung disease can lead to significant morbidity and mortality. In their paper titled Serum Biomarkers of Pulmonary Damage and Risk for Progression of Rheumatoid Arthritis-Associated Lung Disease, Chang and co-authors examined baseline and changes of pulmonary damage biomarkers, specifically serum Krebs von der Leeuwen, or KL6, human surfactant protein D, HSPD, and matrix metalloproteinase 7, MMP7, and progression of ILD in 136 patients with RA. They found that during a median 3-year follow-up, 35% of patients had progression of their ILD, and that higher baseline KL6 and HSPD were associated with progression, while greater changes in KL6 and MMP7 over time were associated with progression also. In an accompanying editorial titled Progressive Pulmonary Fibrosis in Rheumatoid Arthritis Interstitial Lung Disease, Dr. Rojas Serrano for the Instituto Nacional de Enfermedades Respiratorias, Ismael Cosio Villegas, Mexico City, Mexico, reviews the importance of not only these biomarkers, but other factors which are associated with progression of ILD in RA patients. The third RA paper this month is by Leong and co-authors, and is titled Exome Sequencing in Chinese Patients with Anti-Citrulated Protein Antibody Positive Rheumatoid Arthritis in Singapore. They performed whole exome sequencing on 595 ACPAC positive Chinese patients with RA from Singapore. They then did a validation cohort of their initial findings on a further 795 patients with ACPAC positive RA. They were able to identify 2 novel susceptibility variants within the non-MHC loci. However, their whole exome sequencing only identified 5 of 106 known susceptibility loci using SNP identification. And even within those 5, the frequency of none were statistically different from controls. Changing to spondyloarthritis. The next paper is by Chen and co-authors and is titled Clinical Characteristics and Influencing Factors of Hyperkyphosis in a Chinese cohort with Axial Spondyloarthritis, a multi-center retrospective study. In this cross-sectional study, which was conducted on 670 patients with spondyloarthritis from 12 hospitals in China, the investigators found that 34% of patients had hyperkyphosis. They found that male sex, the disease duration, patient global assessment, ESR, MSAS, and ASDAS-CRP were the factors that were associated with the presence of hyperkyphosis. The final paper today on inflammatory arthritis is titled Association Between Patient Perception of Disease Status and Different Components of Minimal Disease Activity Criteria in Psoriatic Arthritis, and is by Yazji and co-authors. They looked at data from a cross-sectional international study performed at 21 centers from 14 countries, and the cohort were 414 adults with psoriatic arthritis of greater than 2 years, the RIPFLAP study. They found that 174, or 42% of the patients, met greater than or equal to 5 criteria for minimal disease activity. Of these 174 patients, 88.4% reported that they felt their disease was either well controlled or in remission. Pain was the most common missed domain, which was reported by the patients who did not feel they had low disease activity or remission. Now switching to SLE, Nishat and co-authors in their paper titled Lived Educational Experience of Young Adults with Childhood and Adult Onset Systemic Lupus Erythematosus, a multi-center Canadian qualitative study, conducted semi-structured interviews of 13 patients with a median age of 20.5 years. There were 7 patients with childhood onset and 6 patients with adult onset SLE from 2 lupus clinics in Canada. The 4 major themes they identified were: 1, challenges due to lupus itself; 2, changes in aspirations, specifically education or career goals; facilitators that led to student success, specifically support from family, friends, parental financial support, and individualized school accommodations. And the 4th was mechanisms for coping and moving forward. The authors concluded that it's important for a clinician to initiate conversation early about the educational experiences of young adults with SLE and to proactively address the challenges they face. Pulmonary hypertension is a known cause of significant morbidity and mortality in patients with systemic sclerosis. In their paper titled Pulmonary Arterial Hypertension Incidence in Patients with Systemic Sclerosis Treated with Bosentan for Digital Ulcers, Experience from the Spring SIR study, Cassi-Baglia and co-authors found that 54 or 7.7% of 727 patients with systemic sclerosis from 37 Italian centers, followed for a median of 2.5 years, had pulmonary arterial hypertension. They found that patients with digital ulcers who were never exposed to bosentan had a higher incidence of pulmonary arterial hypertension compared to those who were exposed to bosentan for digital ulcers. The risk factors that were independently associated with the development of pulmonary hypertension included digital ulceration, age of patient, the modified Rodnan skin score of greater than 4, presence of ILD, and the use of acetylsalicylic acid. Patients treated with bosentan with digital ulcers, however, had a similar incidence of pulmonary arterial hypertension as patients without any microvascular complications who had never received bosentan. Only patients with digital ulcers who were not on bosentan had an increased risk of pulmonary hypertension, and therefore they felt that bosentan use for digital ulcers may help prevent or reduce the risk of the development of pulmonary hypertension. In an accompanying editorial, Doctors Lamni and Mukherjee from Johns Hopkins University School of Medicine, Baltimore, USA, highlight the importance of vascular complications in patients with systemic sclerosis, as well as highlighting the observation that targeting one vascular complication may benefit other vascular complications of systemic sclerosis. The next paper is by Alfin and co-authors, and it examines the issue of can hospitalization admissions be used to improve the management of gout? In this paper, titled Inpatient Management of Gout, Serum Urate Testing and Allopurinol Dose Adjustments, the investigators used electronic health records of greater than 18,000 patients taking allopurinol who were admitted to a hospital in the Christchurch, New Zealand area. They found that serum uric acid was measured in only 16.3% of those patients taking allopurinol, and that 43.1% were above the targeted level. Of the patients with uric acid levels above the targeted level, allopurinol dose was unchanged in the majority of admissions at 77.6%. The authors emphasize that hospital admissions should be more carefully monitored and used to improve targeting of serum uric acids in levels in patients with gout. The final original paper today is titled Impact of Age on Rheumatic Immune-Related Adverse Events, Experience from the Canadian Research Group of Rheumatology and Immuno-Oncology, or CANRIO, and it is by Lee and co-authors, in which they reported on 139 patients from 10 Canadian sites. They found that there was no difference in the severity or numbers of rheumatic disease adverse events induced by immune checkpoint inhibitors when they were compared patients less than 65 years to those greater than or equal to age 65. Similarly, there was no difference in the types of treatments that led to the events. This month's article for Panorama 360 Degrees of Rheumatology is titled, We Would Like You to Get on Board, In this article, the author laments the increased use of specialty referral by the primary hospital team, which, in the author's opinion, results in a less streamlined patient care, which results in a detriment of overall patient care and patient's hospital experience. There are two images in rheumatology this month. The first is titled Mining for Germs, Early Detection of Calcinosis in Juvenile Dermatomyositis using low-dose computed tomography, and it describes a 9-year-old female with a 17-month history of JDM who developed a few small tender nodules. However, a 3D reconstruction of a low-dose whole-body CT showed extensive calcinosis in areas not clinically apparent. The second image, titled Infected Tumor Calcinosis Associated with Rheumatoid Arthritis, describes a 76-year-old woman with long-standing RA. 10 years after development of a calcified mass in her left knee, while on tocilizumab, the woman presented with an enlarging knee swelling and pain and an elevated CRP. An aspiration of the mass showed a cream-like fluid, which was culture positive for E. coli, as was a urine culture. Treatment, levofloxacin, resulted in a resolution of the infection, and the patient was able to begin tocilizumab again without any problems. I suggest that you look at the complete April 2025 edition of the Journal of Rheumatology, either in print form or the online edition. The latter is available at www.jroom.org. Please watch my interviews with the authors, not only of today's highlighted article, but also, if you have missed them, the previous month's interviews. They are available for viewing at our website and on our YouTube channel. If you have any comments on any of the articles in the Journal of Rheumatology, please send them to manuscripts@jroom.com. And please join me for the May 2025 edition of Editor's Summary. And I want to thank you all for listening.